Okay, everyone, as you're kind of trickling in, feel free to obviously put your name in the chat so we know who all is here. Feel free to leave your school district and your email address too. But I am so pleased to have this webinar today. I'm excited to introduce our special guest speaker. Her name is Dr. Alison Brennan, who is an assistant professor and extension mental health specialist at Montana State University. She completed her PhD in developmental science at North Dakota State University. In her current role with MSU, she coordinates and facilitates adult and youth mental health first aid, and she works on several collaborative grant projects to support behavioral health for Montanans. These grant projects include initiatives focused on farm and ranch stress. Outside of work, Dr. Brennan is an avid gardener and enjoys growing and preserving food at home. In fall 2020, she completed the MSU Extension Master Food Preserver training. Welcome, Alison.
Thank you. Thank you for the introduction. And I do have my contact info here on the title slide. If anything comes up and you have questions or want some resources, then you can reach out. Or of course, you can always reach out to Gretchen as well. Her office is literally next door to mine. So we're neighbors on 3rd floor Reed Hall. So to begin, I wanted to just say thank you to all of you out there across Montana, because the work that you do as school nutrition professionals is vital for student success. It is so important for the well-being of students and their families, and truly goes a long way for addressing food insecurity in our communities. So pat yourselves on the back. I know your jobs have not been easy in recent months, but we thank you for all of the wonderful work that you're doing out there to contribute to the nutrition of our students. So I'm going to start with just a little bit of an overview of the way that COVID-19 has impacted communities in Montana. And I am drawing from a collaborative research project that was done by some faculty here at MSU. It was a survey that was sent out and people could respond from April through September of 2020. And so almost 2,000 residents completed the survey. So it was a great sample of people, and there were lots of questions about the impact of COVID-19 on health, but I wanted to zero in on some of these. So if we look at, my animation isn't there. Okay, there we go. If we look at before and after COVID-19, the survey respondents were reporting on kind of the status of different health-related measures, both before and then since COVID-19 happened. And so if we look at food insecurity, 11% said that they were food insecure before the pandemic, and then 18% since COVID-19 started. So we've seen an increase in food insecurity. And of course, these are adults who are responding to this, so it doesn't necessarily tell us about children, but I think you all probably know even better than I do that there has been a really big impact on children in terms of food insecurity. And then more than a third said that they had experienced financial hardship due to COVID-19. So we've got financial issues going on, food insecurity, and then of course you can see the figure there on mental health. And this particular measure, these are questions from a validated psychological distress measure. And so people, again, were asked, how often did you feel nervous? You know, all of these items, both before the pandemic happened and then since it began. And there's just this, you can see this big spike in symptoms of psychological distress. And so this is just the general, population of, and it's a sample of people who responded. But if you look at the CDC has been tracking this information as well. there's just been this massive uptick in symptoms of anxiety and depression since COVID happened. So then if we look at what you all have had to work through, the challenges that you've encountered, of course, there've been a lot of them. This is a rapidly changing set of conditions, right? You're trying to provide nutritious meals in new, innovative, different ways in the face of school closures, with changes to program guidelines. And then, of course, there's been some pretty significant supply chain disruptions, and that has impacted at the local level the availability of certain food items. So schools not being able to actually obtain some of the food items that they need, and often having to make substitutions because they can't get a hold of those items. I just remember early on going to the grocery store and dry goods, right, all gone. There's no flour, there's no yeast, there's no sugar, there's just so many things that became unavailable, fresh produce, all of those kinds of things. So having to manage this rapidly changing environment and deliver meals in a totally different way, and contend with these situational issues that come up. And then, of course, there's the possibility that there were staffing issues at many schools, whether that's because staff got COVID-19 or they were high risk and therefore, couldn't work because they didn't want to put themselves at greater risk. And then another issue that I've heard has come up is parents and families being upset about the way that that meals have been delivered, like the procedures and the actual food items themselves, and maybe not understanding all of the many, many fires you all have to put out on a daily basis. And when I talked to Gretchen about this, she mentioned that lots of staff feel like they're just constantly putting out fires. And I said, they're doing nutritional triage is what it sounds like, right? So you've got doctors and nurses in hospitals doing medical triage. Well, all of you who are school nutrition professionals, you're doing nutritional triage. You're trying to make sure that you are taking care of the most vital and necessary aspects, but there are all of these other things coming at you constantly. So not surprisingly, that can lead to a lot of stress and burnout and symptoms of various things like anxiety and depression. And so my next slide here, this is a national survey of school nutrition professionals that was conducted in March to April of 2020. Respondents from 47 states. So across the United States, and they looked at a lot of information on safety practices concerning COVID-19, but then they also had a lot of questions related to kind of employee well-being. And so they asked about people's level of burnout. And so the three categories I have on there, if you combine them, more than half of the people who participated in this said that they had some level of burnout. And then in terms of work-life balance, feeling like, is your personal and professional life balanced? The people who disagreed, again, more than half. But then what I thought was so fascinating when I read this study was job satisfaction. So we've got high levels of burnout, this imbalance in work and life, and not feeling like they have balanced those roles, but then their job satisfaction is really high. So that's a really important thing, because it says to me that they recognize that the work they're doing is so important, and they experience a lot of satisfaction from knowing that they are so vital and important in the lives of children and families. And so as I was thinking about this, it was like, well, we want to then do what we can to address some of that burnout and encourage more of that balance, right? Because while job satisfaction is really important, we're all human and we have a point at which our minds and bodies can only handle so much, right? So I did want to take just a few minutes here to ask about your experiences. And I'm curious to hear about what have been your major sources of stress, as well as what has inspired you and given you hope throughout all of this. So you can enter in the chat or you can unmute yourselves and talk. What has been stressful, but what has inspired you and given you hope? I gotta open my chat tab here.
Some of the specialists who are on, feel free to also chime in too about what you've noticed from working with school nutrition professionals.
Yes, changing rules and regulations, which at times changed weekly, it seems. Yeah.
This is Shanna Flores in Haber, and I would say the fact that this is all brand new and not having the guidance, and then when the guidance finally arrives, what you've created as your survival is changed to follow that said guidance, and then the criticisms of what you did or how you're constantly changing. I feel like we have a lot of outside criticisms just because people are home and maybe they don't have, things that are occupying their mind other than focusing or fixating on this pandemic. So that's been, I think, the sources of stress for us or our district in regards to food service. The inspiration has been just the fact that when you see the kids open up those lunches that you don't feel like are the very best, they're so excited to get school milk. It's so funny. You would have thought that school milk was the worst thing ever, right? Like I was a milk Nazi in the very beginning, right? You got to take a drink, you got to drink some of it, and to see that full progression to now see kids that are like, yes, school milk. And it's really one of those things where it's kind of COVID safe as well, because the part that you drink is safe, right? I mean, in food service, we've all kind of already, this has been our lives. It's just educating other people to what we do on a regular basis to keep people safe so that they can now do it. I mean, other than adding masks and maybe face shields, it's really business as usual in the food service. So I would say that that's probably the hope part.
Hey, Mother. Thank you for sharing. I also see in the chat one of the things that has given someone hope or positives is adapting an attitude of flexibility and rolling with it. And I liked the word survival. I heard that you really are in a lot of ways in just this state of survival, just trying to do the best you can given the circumstances. And I think that's really important to recognize that, you just take it as it comes and do the best you can. And you kind of have to be your own cheerleader sometimes, or, support one another, because not everybody understands what you're up against. Well, thank you for those of you who shared. And I've heard a lot of other stories and information about just how difficult it is not being able to see some of the kids, because I know that, like was just described, seeing the look on their faces is just so worth it, and knowing they appreciate it. But if you haven't been able to see them in person, that makes it a little more challenging. And so in the interest of trying to have some better personal and professional balance and take care of yourselves and engage in that necessary self-care, I wanted to briefly talk about something called the Healthy Mind Platter. And so all of you are of course familiar with My Plate, which is establishes guidelines for what are the essential dietary components for health and well-being. Well, the Healthy Mind Platter was created by Drs. Siegel and Rock to really frame the essential components of a healthy mind. And so if you think about it as this platter, right, you should have something from each of these categories on a daily basis. And I don't know what it's like for you, but for myself personally, some days, even just trying to think about and come up with ways I can meet these various self-care needs, that can be exhausting. If I've had a long day, I'm thinking, well, I know that I need to work out, but what can I do? And just the whole process of thinking through, what do I need to do to take care of myself today? That can feel exhausting. And so I was thinking about, okay, this is a Healthy Mind Platter. Well, that led me to develop this new resource that I've never used before, a mental wellness menu. So you can see that here are each of these categories, these essential components of mental wellness, and each one is described underneath there. And so you really want to be getting all of these each day. The amount, of course, is going to vary by person. There are some guidelines. So as far as sleep time, it's recommended that adults get at least 8 hours of sleep. Physical time, you want to get some cardio on a regular basis. And that, again, can vary by the person, but you want to integrate some physical time each day. And then we've got playtime, downtime, time in, and connecting time. And I think connecting time is one that has been particularly difficult with the pandemic and social distancing and all of that. And so the goal of this menu then is that you could go through in each of these columns, these essential categories or food groups, if you want to think of it that way, and fill in some ideas, so that if you've had a day where it's just been really stressful and you know that you're in need of some self-care, you know that things are unbalanced, you can look at the menu and say, okay, I'm going to pick this off of my menu for today. And so at the bottom there's some planning resources I've included about the importance of sleep and things you can do if you're not getting high quality sleep, and then physical activity and ways to positively manage stress. So you can use those resources as planning tools to fill in your mental wellness menu. And we have this as a PDF. If anybody's interested, it can be sent, the PDF can be sent electronically, or we can send you printed copies. And just as an example, I filled in some of these. So for me, something that I could do that would be both connecting time and physical time would be taking our dogs for a walk. So then if I've had a long day, I just pick that off of my menu and I've met two of these categories. Playtime, work on a knitting project, right? So you can fill it in according to what your interests and hobbies are, and Make it specific to you. For sleep time, I've got no screen time after 9 p.m., which is maybe a lofty goal for me, but it's important to put the screens down, and then perhaps listening to relaxing music if I'm having trouble falling asleep. So that's our new resource that we are unveiling today, and we hope that you will use that. And then there are lots of other resources that I think are valuable that you could make use of. Oh, thanks, Tracy. One is Thrive for Montana, and Thrive for Montana is a fully online and self-paced program that is based on cognitive behavioral therapy and meditation practices. And so the way that the program works, and it's totally free because it's sponsored by DPHHS, so Montana residents can enroll in the program for free, and you complete some assessment at the beginning of the program that asks about your mood and daily activities and so forth. And then you get tailored feedback and a program to support your mental wellness that's specific to you. And so there's these different modules that the Thrive program contains. And so when I did it, the module I got was rewarding activities. And it was all about the importance of, on a daily basis, integrating some amount of rewarding activities. Because at the time that I completed it, I was working like 60 hours a week. And so it helped me rebalance it. But there are some other modules in there about things like self-talk and so forth. So it'll send you to the most relevant modules for you. And it'll walk you through some information, and then also it challenges you to create a plan for yourself. And it's just very helpful, totally free, anonymous, can be completed by anyone on their own time, anywhere, as long as you have a device that you can use for that. So I highly recommend the Thrive program. It's been shown to be very helpful in alleviating symptoms of anxiety and depression. And then we've got our MSU Extension Montana Egg Producer Stress Resource Clearinghouse. And this clearinghouse of resources was created with egg producers in mind, but there's so much great content on here that anybody can use. And so when you go onto the clearinghouse, you can look at different topics, including what is stress, and that page will show you a bit about how stress affects the mind and the body. You can actually go measure your stress. There's a validated perceived stress scale. You can take that, and then based on your responses, it'll give you some advice about, or some recommendations for how you might think about managing your stress differently. Then just some information about mental health and mental illnesses, and tons of resources in the community are listed up there. From mental health resources to financial to substance use problems, all of those kinds of topics, Montana resources are listed. So that's definitely something to think about if you are looking for some resources. And then the January 2021, so just the most recent edition of School Nutrition, which is the publication of the School Nutrition Association, has excellent articles in there about stress, burnout, self-care, and grief. And Gretchen has that. I think she can send that to anybody. Sorry, I just wanted to check the comments. So she can send you this link. I know it's kind of a long link, but really valuable and great insight in there. And then, okay, come on. The last thing I wanted to say is related to when to seek out professional support. And so maybe this is if you're in an administrative role or a supervisor, it's helping one of your employees to recognize that they might want to think about getting some professional support, or maybe it's for yourself. And so signs and symptoms that you might want to seek professional support, they're going to include any changes really with your mood, your energy, your behavior in ways that make it difficult for you to have enjoyable relationships with other people, that interfere with your ability to work, or are causing significant problems for you just in your activities of daily living. So some of the specific signs would be things like excessive crying. I'm somebody who I cry a lot. Just it's not hard to make me cry. So excessive crying alone is not necessarily an indicator for me, but it's really about that increase, right? Or being unable to control it in social settings where I don't want to be crying. That would be an indicator to me that I might want to get professional support. And then, of course, anger and blaming, and just in general being kind of aggressive and irritable. So if somebody says something, just kind of always taking that negatively, or really just kind of seeming hostile or almost like combative, right? So any of those could be an indication that someone's under a lot of stress and might need some additional support. And then, of course, there can be these cognitive signs like you can't concentrate, you can't stay focused, your mind just kind of wanders, or you've got like intrusive thoughts. You just keep having these recurring thoughts, negative thoughts that you're having difficulty pushing those out, right? So those are all some good indicators. And then feeling hopeless, that one is a really big, important sign. If you feel hopeless, then it's time to reach out for professional support. And so in terms of what services are available, I listed on here the MSU Human Development Clinic, and they do telehealth. So they do telecounseling, and their services are low cost. They use they're income-based services, so that they can be sensitive to people's income needs. And so they are accepting clients, and they can do it all through telecounseling. So they're located here in Bozeman, but they do counseling all across the state. And then they've got a Mont guide called Understanding and Finding Mental Health Providers. And this is a physical resource that we could send to you out in your community that kind of walks you through, well, what are the different kinds of mental health providers? Because there's a lot of terminology and people don't necessarily know what is the difference between, a social worker versus a psychologist and a counselor or a therapist, right? So kind of just goes through the different types of professionals that can provide support and what types of services they might offer, as well as some links for thinking about in your area, what kinds of services are available. And then the last one, they're responding to people under pressure, under the big sky. We call this the distress map. It's kind of a flow chart to help you make decisions about how to help someone who's experiencing distress. So it goes through some of these signs and symptoms that I have here on the left, and asks some questions. And based on how you respond to those, it directs you to different action steps you can take, and then resources that might be helpful, including the National Suicide Prevention Lifeline and the text line, and then some local resources as well. And so those, both the Mont Guide and the Distress Map, those are physical resources that we can send. They are also available online. Just, the text is online, but I think that they're a lot more effective when you can see it all packaged together. So we'd be happy to share those if that's something you're interested in. And with that, I just wanted to end by saying that I hope that, if you are experiencing a lot of stress and some of those burnout symptoms and, some of these indicators that things are not quite balanced, that there are lots of resources out there to help you. And you can feel free to reach out to me if you have questions for yourself or for somebody who you work with. Okay. So you can contact me or Gretchen for those. And then there are some poll items that we have that Gretchen will put up the poll there for people who are watching the recording. If you want to, you can send me your responses, but I think it's just helpful to reflect on the questions and to think about, well, is this something that I can use? Do I feel like that mental wellness menu might be a tool that I'll consider using?
One of the things that I liked about the mental wellness menu too is I can imagine as like a team building exercise, printing it out and at a staff meeting with everyone, maybe giving it to your staff. And you don't have to share all of your goals, but even just having like an accountability buddy for one of them to make sure, if your goal is to get more sleep, just having another person kind of be in on that goal too. So then you can talk about it and be like, last night did not go well, or last night was great. These are my, kind of just to keep you accountable to taking care of yourself, basically.
Yep. Yeah. And it can be hard because, sometimes self-care isn't fun. We have this idea of self-care as like bubble baths and chocolate, but sometimes self-care is going for a walk, even when I don't feel like going for a walk, or, turning off the television when I've been binge watching Netflix for hours, right? So it's not always fun to do self-care, but it's really important. So yeah, if you've got somebody who you're kind of in it together, I think that helps a little bit.
Are there any questions or comments for Alison? Or just things you want to share about your experience the last few months?
Alison, this is Rochelle. This was so great. Thank you for sharing all these resources. And it really is eye-opening to see the data. We all talk to our friends and have anecdotal stories, but just to see the stats is so impressive and sad at the same time. I mean, impressive at the differences and sad because of what it indicates. So yeah. I think this is just so timely to be sharing these resources, because this far into all of our shutdown and cut off from life, it's really important to get this out there. So thank you for taking the time to do that.
You're welcome.
Yeah, I definitely agree that this is timely too, because I think maybe some of us, maybe just myself, did a lot of self-care when this first started. And then as it kind of went on, I feel like I kind of dropped off, it wasn't as important. And it's been a really good reminder that I need to always go back to my menu and always go back to those things to just kind of keep up the day-to-day work of taking care.
Yeah. Thanks, Kathy.
Okay. Did you have any other final thoughts, Alison?
No, just that I hope that you'll check out some of the links, and you said you're going to share the slides out so that people have those links.
Yeah, so I'm going to share the slides and the links to all this, and I'll also post a recording too, so you can rewatch or share with other people on your staff if you want to. So yeah, you'll basically get to keep all of this information.
Good. Awesome. Well, thank you everybody for joining, and be well and stay safe.